Okay, so my presentation covered the spectrum of atopic dermatitis throughout different ages, namely comparing and contrasting AD in children with AD in adults. Of course, we are all familiar with the different AD clinical patterns according to age. So the main focus of my presentation was not on clinical patterns, because you are all aware of them, but on possibly different pathophysiological mechanisms that make children's AD different from adults' AD. And the truth is, AD is such a heterogeneous condition that we dermatologists really need to start organizing patients within this heterogeneity in order to properly make the most patient-centered therapeutic choices. So all the topics that I presented in my talk were based on very recent research. And I guess the paradigm of thinking about children and adult AD is shifting. More important than the patient's age at the time of the consultation, research is now focusing on the time of onset of AD. So all children with AD have pediatric onset AD, of course. However, adults with AD can either have pediatric onset AD or adult onset AD. And many interesting studies have been published this year, 2023, showing that there are some fundamental differences between these two groups. And these differences may have an impact on endophenotype categorization and obviously affect systemic treatment selection for each case. So in this particular topic, pediatric onset AD shows a more consistent predominance of the Th2 immune activation. And maybe these patients can be primarily targeted by specific type 2 antagonists like biologics. And on the other hand, adult onset AD may show additional benefit from a broader treatment strategy that could also tackle Th1 immune activation in addition to Th2 modulation. Because some data shows that the adult onset AD may be more heterogeneous from a pathophysiological perspective, because multiple immune axes may be activated at the same time. So the future in treating moderate to severe AD will most likely involve personalized medicine, and age of onset stratification can be really one possible way to achieve it.